Hi, I'm Hiroki Takeda, Doctor of Oriental Medicine. Today I'm going to introduce one needling technique. That is, insert needle into the tube, needle tube, guide tube with one hand. So let me show you how I do. At first, insert needle, and after finishing needling, you get the needle back to the tube with one hand. So rather than use both hands for inserting. So this technique is mainly used in Japanese style because Japanese style use reinsertion many times. So in my practice, I do not use insertion technique, but I rather just leave the tip of needle at the surface. So needle is not inserted. So just needle is stimulating, and in this case, I use needle insertion many times with one hand. So, okay, so let me explain why the benefit of mastering this technique. First of all, it increases the efficacy or efficiency of your treatment significantly, because when you use by doing this, you can just leave your one hand on the patient's skin, and so that you can use your other hand, non-insertion hand for looking for points, while you are using the other needling hand for reinserting to the tube, so like this. So when I do this, I can keep looking for points. Then like this. So it increases efficacy significantly. The next reason, second reason is it's about the benefit of the treatment. So if you use this way, you can keep your hand looking for the patient on the patient constantly. That's why patient always get touched by you. So that gives you your patient very good comfort. So rather than your other hand on and off, keep doing that, it's very distracting and uncomfortable. So rather than that, you can just keep your other hand on the patient. So that gives the patient very comfort, like this. The last reason for mastering this benefit of this mastering this technique is that it's increased your sensitivity of your hand to the needles. So by doing this, you cultivate the sensitivity of your hand to the needle very much. So that actually can be a foundation of your whole needling technique. It's like soccer players played balls, like lifting and doing something like that, and that increased their sensitivity to the ball, of the whole body to the ball. Likewise, with this by practicing this technique, you can cultivate your sensitivity of your hand to the needles. So now, okay, so let me explain how to practice this. Okay, at first you insert needle and take tube out, the needle and insert. And go slowly. Okay. Now let me explain step by step. The point is how you keep the tube. So you keep the tube with your index finger and middle finger. So I keep this kind of close to the tip of the fingers here, nearby the first joints, like this. And after using this, move needles like this and make sure the tube is directed in the same direction. So now here, needle and the tube looks parallel. And from here, I move the needle parallel and insert the edge of the handle of the needle tip of the hand of the needle into the end of the tube and use a gravity to drop. So here again, keep this, and if using, move the needle to go to the parallel to it. Then move this, insert like this. And another point is which fingers you use for keeping the handle and the tube and the needle. So for keeping the tube, you use 3 fingers, mainly ring finger and middle finger for keeping the tube here, and for needle, the thumb and the index finger. So in this way, you can move your the needle freely. So you can adjust the location of the tip of the needle very easily. Okay, let me do this. Here, hold it and move the needle direction parallel, and now I can move this needle freely. So now I can insert needle here like this. Okay, so let me just do smoothly. I'll show you smoothly. Okay, so when you practice this technique, at first you want to watch. Probably you have to watch your finger, your hand. But after you getting used to some extent, I recommend you to do this without looking at your hand and like this. But I'm doing this. By this way, you can cultivate your sensitivity much more effectively, and also it allows you if you can you are able to do this without looking at. It allows you to perform your treatment not distracted by this technique, so that you can focus on patient condition, or even you can kind of meditate into your treatment. So now I can even close my eyes and doing this, and my senses will open to how I feel in the patient. So you can do this way. So this is a great technique to practice, and especially I practice this every day, literally every day, and so that I can always keep my sensitivity at a good level, and also keep the condition of the muscle structure at a good level. So please try and enjoy the benefit of this technique. Okay, so if you have any question, please feel free to contact me. So I'd be happy to answer your question. Okay, so thank you for listening and watching this video, and I'll see you next time.